If I were to be asked a question, when should a family consider starting hospice care? My almost universal answer would be sooner than you think. And the reason I say that is because, first of all, there's been a kind of a general idea or a perception of hospice from the past, and which still is consistent today, that most people think that you don't call hospice in until someone is actually in the process of dying. But that could not be farther from the truth. In fact, I'll preface my comments with just a story that in our hospice company, after the fact, we always send out a survey of our services and what could we have done better. At the end of that survey, we have a general comment section. And without prompting, well more than half of our respondents write in the comment, "We wish we had called hospice much sooner." And I say with no prompting at all, that is the impression that people have after the fact. So if I was to answer that question ahead of time, I would say call in hospice much sooner than you would expect. The reason why is that the quality of life is a goal of hospice. So many people have the perception that calling in hospice is kind of a death sentence, and it's not. It's, in fact, statistically, I've read recently, in fact, that not only with cancer is kind of where the history of hospice began, but with almost every diagnosis, when hospice is called in, the life expectancy is actually lengthened, not shortened. So the training that our nurses and aides and caregivers have to help with pain management and comfort measures actually most of the time will prolong life. And so and medical treatment is not the only thing that a person should be thinking about. There's so many other services that hospice provides. There's spiritual care, not only for the individual but for the family, any member of the family or even friends that may be involved, as well as social work that can help families sometimes in very critical times where they have to figure out finances or other challenges, social challenges that they may not know how to take care of. And the social worker can help them take care of those things. And we call in other professionals when time requires for financial assistance or advice and those sorts of things. And I'll just tell a quick story where we had a nurse that understood the disease process that our patient was going through and realized that the end of life was coming soon. Although the patient looked like their health wasn't changing very much. She insisted that the family gather together, and sons and grandsons and granddaughters came from worldwide to come see Dad and Grandpa one more time, and he passed away just a few days later after most of those visits were made. And the family was so grateful that the nurse was able to be in tune well enough to help the entire family have a good experience at end of life. So the answer to the question, when should hospice be brought in? Much, much sooner than people think. And you'd be surprised at the benefit to the individual and the family if that is done.
For more information on this topic or other topics, please check out the other areas on the Coalition website.